I'm Jo Inchley and I am the director of the Triumph Network.
And I'm Christina McMellon. I am a research associate with the Triumph Network. I have particular responsibility for young people's participation in the network and ensuring that young people are involved in all of the conversations around the network's development and outputs.
Triumph focuses on young people aged 10 to 24. Obviously their lives were disrupted in many ways. The impacts were different for different populations. So we can't look at young people as a whole and say it's been the same for everyone, because absolutely we know that's not the case. And we know that for many young people who may be living in more disadvantaged circumstances, the impacts have been far greater and will continue to be so. So some of the work that we've been doing in Triumph has tried to kind of tease that out, I suppose, the differential impact on different groups within the population. And we've always had a focus on some of the groups that we know are at higher risk of mental health problems, so LGBT plus young people and also care experienced young people. So we've got different strands of work really looking at how we can best support those young people with their mental health and well-being. And obviously in lockdown there's been particular impacts for them, which is really important to recognise and try and address.
And I think it's really important to note as well that those impacts haven't been kind of the same across the whole period of the pandemic, that those impacts have changed at different points, and that the experiences that young people had in the second lockdown were very different to the experiences that they had in the first lockdown, but also that there are kind of different impacts as we move out of the pandemic now. So right at the very beginning of the pandemic, we were just launching a seed funding programme, and we kind of talked a lot about whether it would be more appropriate for that funding to be redirected to projects that were specifically COVID related. But I think because we'd done a lot of work previously looking at what the priorities, working with all of our stakeholders, with young people, with practitioners, with policymakers, with academics, looking at what our priorities, our research priorities should be. And also because the things that we had identified as priorities were still important. We're still operating within the same context, and those issues are still going to be there during the pandemic and after the pandemic. So we chose not to completely pivot, although we did refocus in some specific areas. I think we've always felt that young people's voices need to be heard, and that's fundamental to Triumph. That's part of our core set of values, is that young people are equal partners with practitioners, with policymakers and with academics.
I think one of the key things going forward though is that we have to bring young people into those conversations much earlier and put them at the heart of the sort of decision making that happens now around recovery planning. Even in the sort of research that's been published and helped to guide decisions so far, I think young people's voice is limited. So it's really important to understand young people's perspectives and experiences across the board. And as we look forward, as we think about what our research priorities are going forward, as we think about where the investment from government needs to be focused and where we think about how to kind of rebuild the support and services that young people need, then we need to be guided by young people's voice in that and understand really how they've been impacted and how we can best help them.
So the Youth Advisory Group for Triumph is made up of 16 young people who are 16 to 25 from across the UK. They are involved in all of the decisions about the network, and they're very involved in kind of helping us to guide the way that the network has developed over the last 2 years. They have been involved in all of the central decisions in terms of things like developing our research priorities, to allocate our seed funding. And the project that they have on the go at the moment is that they do have their own research budget where they are developing their own two pieces of research, one much bigger than the other one. They're an incredibly active group of young people and really inspiring to work with and really fun to work with as well. What I became very aware of very early on in the pandemic was a kind of a responsibility to them as a group of young people as well, and their mental health and supporting them as a group. And So we put a lot of emphasis early on in the pandemic at looking at how do we provide spaces for more relaxed, more kind of informal spaces for them to get together and just kind of discuss what was going on. The pandemic has really changed the way that we have worked, and I think it's fair to say it's really strengthened the YAG as a group. I think we've been through this experience together, we've supported each other, and also we found ways of working together virtually that really work for us. And I would definitely say that as we kind of move through the pandemic, we have learnt how to work with young people in difficult situations, learnt how to develop groups and build connections and relationships virtually, and that's been really, really valuable.
And one of the things that's allowed us to do, I think, is be more responsive to other research that's going on. So there have been a number of different projects that have approached the Triumph YAG to ask for input, and specifically in relation to COVID, we've worked with the ARC study based at Oxford University, which was a study looking at resilience within the COVID pandemic amongst young people and their families. So the YAG, a few of the YAG were involved in that and supporting development of the study materials and working on social media and so on. And we've also been involved with the UKRI project led by the Emerging Minds Network. And again, our young people have really fed into that project and helped guide how that project's developed.
At the beginning of the pandemic, there was, such a rush to create so much kind of policy and legislation and guidance. A lot of the things that were being developed didn't have that child rights impact assessment. It was a case of looking across all of the legislation, all of the policy, all of the guidance, and looking at how does this impact on children's rights as they're set out by the UN Convention on the Rights of the Child and the wider guidance to the UNCRC. There were three main conclusions that came out of that. One was about the increased demand for services, both during the pandemic, but then also potentially after the pandemic, thinking about how those services needed to be different during the pandemic, particularly because of the lockdown. Secondly, there was something really important about particular groups of young people whose rights were particularly being eroded as a result of the pandemic, which cut across a lot of the groups that we've already probably mentioned in terms of inequalities, but around care experienced young people who are involved in the criminal justice system, LGBTQ plus young people, Black and minority ethnic young people. And then the third thing was about the need for young people to be involved in developing policy. You just have better policy if young people are involved in it.
And I mean, just to add to that, I suppose it's really interesting that at the beginning of the pandemic, a lot of the policy decisions were driven by trying to protect the elderly and the vulnerable in our society. And children and young people were completely overlooked in that early decision making. And only after the first lockdown and school closures did people start to sort of think about the impact on young people. So this sort of in-depth look at how children's rights were affected by the legislation and the decisions that were made is really important, I think, in terms of planning for the future. We've learnt many things from the networks, but in terms of working together, I think it has showed the benefit of having a group of researchers and colleagues working together across the UK within the same field and the same area of research and connecting up people. So the networks have facilitated that communication and that connection between not just research teams, which is really beneficial to bring those different disciplinary perspectives to address a challenge, which in this case is mental health, but also to enable us to connect up with non-academics, whether that be young people themselves or different population groups depending on who the network's working with, but also practitioners and policymakers. And I think having that multidisciplinary perspective around an issue to identify what are the problems, what are the research questions, and then how can we address them, how can we develop new methodologies to approach this, and what are the solutions and how do we take those forward, has been one of the key kind of learning points coming out. And I think all the networks now are looking at how we can sustain those connections going forward when we don't have necessarily the network infrastructure in place in quite the same way. But we've established an infrastructure and we've established capacity in the field, and I think there's loads to learn from that in terms of how we can take that forward.
Yeah, from my perspective, it will not surprise you to hear that what I would like to see changing in the research landscape is more involvement of young people, and more involvement of young people in meaningful ways. So I think that there is an increasing focus on co-production in public health research, and that is wonderful. But I think we need to start really valuing that and understanding that takes time and resources, and that it isn't just an add-on, that it really is central to the work that we do, and that it's not only something we do because we're kind of told that we have to do it, but that it really does improve the quality and outputs of and impact of the research that we do.